So today we're talking about how COVID-19 kills from a medical perspective, from mild to severe and critical cases. So basically explaining what happens when you get the infection up to the end of either being healed or sadly dying. So stage one, infection. That's the infection. So coronavirus spreads from person to person through infected droplets. These droplets are most commonly expelled into the air in the form of cough, sneeze, or simply exhalation. All these means of transmission put infected droplets into the air and the virus spreads to you when these droplets enter your system. This can happen by you simply breathing them in or transmission via surfaces. As soon as the virus enters your system, you begin to enter the incubation stage. It's at this point that the coronavirus begins to hijack the cells in your in your body, turning them into coronavirus replicating machines. Typically, the virus first infects the lining of your throat and lungs, with the infected cells producing more viruses, which go on to infect more cells. During the incubation stage, while your body is rapidly producing the virus, you won't yet know that you are sick. That is because the incubation stage is defined as the period between the time of infection and when you start showing symptoms. This period can last between 2 to 14 days, but in the average cases, symptoms begin to emerge after about 5 days. So when you start showing symptoms, you exit the incubation stage and start to enter the next phase of the virus, or at least some of the people do. This brings us to asymptomatic carriers of the coronavirus, those who have the virus but don't show any symptoms. These are the people who never progress beyond the incubation stage, with their body fighting off the virus before any emergence of symptoms. These people are infectious before any symptoms show, meaning these asymptomatic carriers of the virus can still spread the disease to others who might not be able to fight off the disease as easily as them. And therefore, self-isolation is super important, and why it's vital to take the process seriously even if you have no symptoms and even if you believe you are healthier enough to fight off the virus. You may still be infected and could still pass the virus on to others. You might be wondering how many people are asymptomatic and never progress to the next phase. There is really no satisfying answer because no one knows. As I'm sure you are fully aware, COVID-19 is a brand new strain of coronavirus. So at this stage, we still do not know much about it, and that is why when you look at articles and studies about the proportion of asymptomatic people, you will get very mixed results. This is really highlighted by the Center for Evidence-Based Medicine at Oxford University, who completed a meta-analysis of COVID-19 research and found that between 5 and 80% of the people are asymptomatic. The analysis described this as the fork of the pandemic, where one question gets a whole bunch of different answers depending on who you asks. Because we don't know that much about the virus yet. So in some proportion of the cases, the patient begins to develop symptoms generally about 5 days after they were infected. There are mostly 3 levels of the disease that people can begin experiencing at this point. The most common is just a mild disease, which with some experiencing a severe disease and even fewer suffering from a critical condition. And that takes us to the most common, that is the mild case. About 8% of those who show symptoms will only have mild symptoms. Those symptoms can characteristically include a dry cough, a fever, although various aches, headaches, and sore throats are also possible. The dry cough can be explained by the infection in the throat and lungs mentioned earlier, with the body reacting to these cells becoming infected. With some people coughing up sputum towards the end of the infection, with mucus containing dead lung cells that the virus has killed. The other symptoms like fever are the result of the body's immune system fighting off the infection. And as such, the symptoms begin to subside once the patient rests and the immune system has a chance to defeat the infection. This means that those with mild symptoms typically only need to rest drink plenty of fluids, and take paracetamol if necessary. This phase typically lasts about a week, at which point the body should have defeated the virus. The immune system stops releasing cytokines and the symptoms subsides, allowing for a full recovery. However, this is not the reality for everybody, with some suffering from more severe symptoms. Data out of China suggests about 14% of the infected end with those severe symptoms. The more severe form of the virus developed as a result of the immune system response to the virus. This is because these symptoms begin to emerge when the immune system overreacts to the infection with the chemical signals it sends to the rest of the body, resulting in inflammation and damage. The immune system is attempting to signal the infection to the rest of the body, but by overreacting, the immune system is failing to strike the right balance and can cause excess inflammation. The inflammation is commonly centered around the lungs, resulting into fluids and mucus accumulating, making breathing more difficult as labored, as well as reducing blood oxygen levels. It is because of this that you hear so much about people being put on ventilators as this machinery is put in place to assist with the patient's breathing and keep them alive. Some patients also end up with critical symptoms, currently around about 6%. When a patient reaches this phase, they are normally suffering from a number of issues, with the immune system really escalating out of control while trying to fight off the virus. At this point, breathing is far from only issue. The disease is no longer limited to the lungs only. There is inflammation throughout most of the body organs. This can often lead to kidney issues, with viruses sort of hijacking cells in the kidney as well as the lungs. Considering the kidney's role in filtering your blood, compromised kidney can lead to a build-up of waste in the body. By this time in the infection, the lungs and kidneys are often only the start of the issue, with potential for a chain reaction throughout the whole body as the immune system tries desperately to fight off the disease, potentially leading to shock. Shock causes the body's blood pressure to drop significantly. At this point, other organs can stop functioning properly or just fail entirely. As the immune system fails to respond to the virus, the fight will move across the whole body, potentially leading to multi-organ failure. This can still be treated with extracorporeal membrane oxygenation. This is when tubes are used to remove blood from the body before oxygenating it and returning it in the body, essentially working as an artificial lung. This is highly invasive and it's not always possible, depending on a variety of factors. There is no guarantee that it will be successful, and often as other organs begin to fail or septic shock hits in, this artificial lung is no longer sufficient to keep the body operating. As you probably gathered, this is the point at which patients begin to die. Not everyone reaches the late and more advanced stages before they pass away, with many dying simply because they are unable to breathe. As the lungs begin to fill and the body oxygen levels in the blood begins to fall, they will often begin struggling to stay awake and find their energy slipping away until they become unconscious. This means very often when someone dies from coronavirus, it is simply a process of them falling unconscious as their oxygen simply depletes before they slip away and their lungs and heart fail. This death isn't the desperate gasping for breath that you might have imagined. Instead, it is slower, more peaceful process that very often the patient is barely aware of. And I thought I should come around and chat about this. And if you have anything to add, please come forward. Thank you very much. Thank you for listening.